Since the Patient Protection and Affordable Care Act was signed into law by President Obama on March 23, 2010, it has failed to live up to its promise of offering affordable health care for all Americans. On the state and federally run insurance exchanges, only some health insurance providers' plans are available. This lack of competition drives insurance costs higher than they should be if the government had no restrictions on which companies could join the exchanges. Also, the lack of transparency between healthcare providers and insurance companies allows hospitals to justify charging the insurance companies more money, which in turn is passed down to the consumer. Although some insurance plans are cheaper than others, the cheaper ones have high deductibles and copays that most consumers can't afford to pay out of pocket. Since everyone has to be covered, the middle class is tasked with paying for the coverage of those who cannot afford it. Finally, the expansion of Medicaid to those making up to 138% of the federal poverty level has deferred more costs to the middle class families and individuals. In order to eliminate the extra costs that have come with Obamacare, the government must allow for a more competitive market by opening the exchanges to all insurance companies. There should also be a system in place where all the insurance companies can see what providers are charging for their services, so consumers can be warned and insurance companies can work with providers to lower costs. We also believe that no one should be forced to purchase health insurance. If someone doesn't feel they need it, they shouldn't be forced to pay a stiff penalty. The expansion of Medicare should be repealed altogether, as it only passes more cost on to middle and upper class customers. Health insurance was already expensive in the first place. We don't need it to be any more expensive. The only attribute of Obamacare that should be kept is the law that no one can be denied coverage because of pre-existing conditions.